Some raise their hands for the questions. Some raise their hands for the answers. Who raises concern for the mother whose child was killed while raising their hands up? Who raises the taxes without raising the wages? Will we raise our standard of education? Will we raise our voices, raise the vibration? If it takes a village to raise a child, what will it take to raise the nation? If it takes a village to raise a child, what will it take to raise the nation?
What's up? Welcome back to The Mask. Thank you for joining in with us every week. I'm your host, Chantel Allen, and this is my crew.
Hey, I'm Kemi. I'm a junior in college.
Hi, I'm Jason. I'm going to be a freshman in college.
Yo, I'm Riley. I'm going to be in 10th grade.
Hi, I'm Jada. I'm going to be an 11th grader in high school.
Yo, I'm Z, and I'm about to be a junior.
Today we're discussing the medical industry and its impact on COVID-19. I'm wondering, has anybody here ever gotten COVID-19?
Yes.
Yeah? Tell me about it. Was it bad?
It was terrible. I'm asymptomatic, so I didn't know I had it because I didn't show any of the symptoms. Like my mom, my sister, my brother, like the whole household was sick.
Wow.
So we were all trapped in the house together for 2 to 3 weeks. Couldn't leave the house or do nothing. Like we were stuck in the house and it was like terrible. We got mad at each other a lot, kind of isolated. Sometimes like it kind of brought us closer because we had a lot of good moments to where we just, chilled together, had fun together, maybe watch movies, have movie nights. I missed school, like 3 weeks of school, so that set me back like with my grades. That set me back a lot. So I had a whole bunch of missing assignments. My grades went down, and that made me struggle in school a little bit. And it was my freshman year, so I was kind of new to high school. And I actually got it right before Halloween, so I missed Halloween. I missed all the fun stuff, everything. It was terrible. And I feel like being stuck in your house for that long without being able to go outside and go do stuff is really it affects your mental a lot. And yes, I had my phone and I had my family, but it was really hard because I like going to school to interact with people. And isolating, that takes a big toll on your mental. It can cause you to go into a depression and all that.
Wow, that sounds like a lot to handle. Did anybody else have to experience COVID-19?
I had COVID once.
Yeah, tell me about it. What happened?
It was kind of funny because I didn't really have any symptoms as well. I was just, for the majority of it, so there was this day I just felt really, really exhausted, more than usual, so I just took a test and then I found out that I had it. So I had to isolate for a couple weeks.
Did you have fear of spreading it to any of your elders or other people in the community?
Yeah, because my mom's a nurse, so if she gets COVID and she goes to work, that's a lot of patients that could also be affected. So I really had to just isolate in my room. And, they made me have my own fork and spoon and my cup and everything. So.
Yeah.
I had COVID and I was really exhausted too. I found out after I came back from out of town, and I thought I infected my dad, but I didn't, luckily. But I was just really, really tired too.
Are any of you guys from Chicago or have family in Chicago?
Yeah, I do.
Did you know that the Omicron virus actually impacted the Black community 4 times higher than the Asian community, 3 times higher than the Latinx community, and twice as much as the white community? How does that make you feel about that, having family in Chicago?
I feel like they're out for us because we were just we didn't get affected as much with COVID, and now we're up there? It doesn't make sense.
Yeah, early on they were saying that our numbers were lower, and then all of a sudden this new strain comes out, right? And then all of a sudden we're being impacted at a higher rate. You said you had family in Chicago. Are you from Chicago?
I have family there.
Okay.
Luckily, like that's where most of my older family lives. So I'm glad that none of them got COVID because otherwise it could have possibly been really, really bad.
Yeah. How did that impact you, not being able to have access to your elders in the community or face-to-face access?
It was just really hard because, as you know, elders are getting older. And my grandma also had COVID, and she was asymptomatic, and she had COVID 3 times. So she couldn't even leave her house, and she never even left. So it was kind of weird how she got COVID in her own house.
I think we were all really concerned because, you know, the older you get, the harder it is for your body to fight off some things. So when it was kind of like your grandparents or your older aunts and uncles and stuff, you were just kind of worried that hopefully they do make it if they do get COVID and it doesn't really ramp anything up.
Yeah.
I have some family in Chicago, and we did hear from them, and they were okay. But of course, they had some people that were also in the house, other than my family, that were sick. And I was always concerned for them because that statistic that you brought up earlier is really startling. And I just felt really scared for them during that time.
So we've heard about, you know, our families in Chicago. We've heard from our young people. And when we come back from this commercial, we're going to hear more about how this really impacted our own communities that we live in. We'll be right back.
The CDC estimates that 82% of Minnesota children ages 6 months to 17 years have been infected with SARS-CoV-2, which causes COVID-19. With many respiratory diseases spreading right now, including the flu, RSV, and COVID, it's important to take the steps to keep our children safe. Get vaccinated if eligible and get your booster shot when due. Learn more information at mn.gov/COVID-19.
Welcome back to The Mask. We've been talking about the medical industry and its direct impact on COVID-19. I'm Chantel Allen, your host, and this is my crew. So I'm wondering, guys, do any of you have a community clinic or a community doctor that you really trust?
Yeah.
You do? Tell me about it. What about them makes you trust them?
They show love, like they actually care about you.
Wow.
And it's weird because usually when I go to like a different doctor, like a Maple Grove, they are not in a hurry to see me at all. They want to be quick and done. At my family doctor, I feel like they really care about me.
Yeah, my doctor that I usually go to, we have nice like conversations. They be like, oh, how was your day? Like other doctors that I went to, they're just like, oh, yep, your name. Oh, yep, we got you, did that, you did that. Okay, bye, you can leave now. But like my doctor cares about me, be like, oh, that's good. Okay, so how are you feeling? Like, I like feel like we friends.
Yeah. They're checking in with your whole being, not just saying, what's wrong with your elbow today? And then getting out of there, huh?
Yeah, like physically, mentally, all that, they care.
Yeah, yeah. Do you guys think that that makes a huge difference in how the care is given to you, just how they show up?
Yes.
Yeah, for sure.
I haven't had like one doctor like consistently because the doctor that I had changed specialties, but like the doctors I've been going to, they check in, make jokes, make you feel comfortable to be there. So it's not like you're just sitting there on the table and waiting to see what they have to say.
Yeah. Yeah. I mean, we talked a little bit about some of the weird things we heard in social media and the myths and stuff. Do you think that having a trusted doctor will help to straighten some of that out?
Yes.
I mean, do you think that having a Black doctor would help a little bit better?
Yes.
Yeah.
Yes.
They don't sugarcoat
A little
nothing.
more comfortable. You can
More
connect with them more because, you know, we're the same. We're family, basically. Like, we can, like, I have a stronger connection to them than, like, a doctor of a different race. But, like, for the same race, like, oh, I can connect with you more. Like, oh, this happened in the community. Oh, I heard about that. Oh, how did that impact you? Oh, this is that. We can have, like, deep conversations about our community because, like, we share it. We have a certain, like, special connection that I don't have to, like, other races.
And we talked about it on a previous episode, how, like, people of color, they understand that your pain isn't fake, because a lot of times doctors don't believe you when you say that something's wrong with you. So I feel like a doctor of color would understand, like, oh yeah, you are telling the truth, because the same thing happens to them sometimes if they go to the doctor.
Right. What can the medical industry do to make you trust them more if we happen to have another pandemic of some sort?
I think they just have to be more understanding and kind of like down to earth, because doctors use a lot of big words and a lot of medical terms and grammar that, you know, a lot of people don't really understand.
Right.
So you might just be listening, but you actually don't know you don't understand what's probably wrong with you or what they're actually trying to say.
I believe that they need to check in more, not only when you visit, but if they can have a system where they check in on you outside of the office, just to have that human connection. God forbid that there is another pandemic.
I agree. I think like even if they do like a weekly robocall with more information about the pandemic, if there is one, so that people don't have to go looking for it for themselves, you can hear it straight from a doctor, so they can tell you what's happening, the updates on it, what's the risks or stuff you can do to help prevent you from getting it.
That's good.
I agree with that. I feel like they need to do that, and also like get comfortable with your patients, like maybe crack a small little joke or something, or ask them like how are they doing. Definitely like try to explain it more, because some people don't understand, and there's a lot of people who are scared to ask questions or scared to be like, hey, can you like further explain this, because I don't understand like all these words you're using or all the doctor terms. So I feel like they should like automatically like explain it more so people can understand like what's actually going on with them, instead of like going into the doctor thinking like, oh, I'm finally gonna, you know, realize what's going on with me, and then leave like, oh, that's disappointing, I don't know what's going on with me at all. That was like a waste of time.
Something to add on to that is the doctor shouldn't be so passive when it comes to answering questions or things that people, as you said, are scared to ask. You want to make sure that you feel comfortable asking a trained professional, and the trained professional will get back to you with an adequate answer.
Exactly.
Yeah,
Definitely.
I think hospitals are like an intimidating place already. So when you kind of have an intimidating character, it just makes it worse. So if like doctors are more open and like friendly, you don't have to be like Kevin Hart in the lab or anything. Like just like try and be like more open and like more connecting.
That's right.
Don't be fake.
Yeah, don't be fake.
Don't be fake. It's not worth it.
So this has been a great conversation. We're going to head to commercial. Up next, we have Ruben Moore. He is the president of Community Care. He is here to give us his expertise around COVID-19. We'll see you in a minute.
Why did I get vaccinated?
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 So I can hang with my girlfriends.
To keep my brother safe.
So I can go shopping.
So I can play ball.
So what are you waiting for?
What are you waiting for?
What are you waiting for? Get vaccinated.
Get vaccinated.
So we can all get back to doing what we love.
Let's welcome Ruben Moore to the set.
Hi.
Ruben Moore is the president of Minnesota Community Care, and he's here to talk about COVID-19 from a medical perspective. Welcome.
Well, thank you all for having me.
So you operate 19 clinics in communities of color. How did COVID-19 impact the work that you were doing?
You know, if you think of COVID-19, it was like a shock on the entire world. One day, everyone was going to work, having fun, playing in parks, to being completely shut down. And shut down in fear of their losing their lives, their loved ones, not understanding the impact this will have on our day-to-day livelihood. Asked to stay home from school, from work. It was an amazing experience on the back end, but when we're in it, it was so fearful. And we had so much uncertainty. We had so many folks losing their lives, and life just really changed quickly. And for clinics like ours, that meant we had to close our doors and adopt telehealth practices and new ways to think about how we can help reduce the fear of COVID-19.
I know that when the pandemic hit, I started having allergy issues and I needed to re-up on my meds. But I had this fear of going to the medical facilities, whether it was a hospital or doctors. Did you guys experience any of that?
Yes.
Yeah.
Tell me about it. What?
It was kind of weird because it was a pandemic, but also like normally places that you feel safe were kind of different because in a hospital, there were a lot of patients. So even if you did step in a hospital, you probably have a higher chance of getting COVID than probably not being in one.
Yeah. When I went to the hospital, I broke my wrist in 2 places. The doctors, I had to wait like an hour. It was like, it was broke. They told me that it's not broken, it's just sprained. And then, so when they put me on the x-ray, it was like, oh wow, yep, it's broken in 2 places. So they weren't even taking me serious.
Wow, they were just trying to move you out of there as it was a zone.
It seems as though you have to ask twice, maybe 3 times just to get an adequate answer, and it shouldn't be like that.
Yeah, when I had got injured playing basketball, I got a stress fracture on my ankle, and I had to wait in the hospital for like 3-4 hours just to get a boot, just for them to tell me like, oh, you just have a stress fracture, you just need to wear the boot for a couple weeks. It took like 3-4 hours.
How did you feel sitting in that waiting room with other folks that could possibly have COVID-19?
It was really uncomfortable because I went to the children's hospital and there was a lot of like kids there. They were coughing, sneezing. Like I had my mask on and I was just sitting there like I like had a lot of anxiety. I was so scared. I took a COVID test when I got home because I was like, we could have gotten sick while like we were there for 4 hours, could have been contaminated. Like it was really scary.
Yeah, that was rough, especially like you were saying, these are supposed to be some of the safest places in our society, and everybody was fearful to go get help at that time. Were there any immediate concerns in the community about getting the vaccination?
Yes, there were, right? We have communities that have been interacting with the healthcare system that has historically been untrustworthy. So healthcare has done bad things, right? Our government has done bad things, especially in communities of color. And so now you got this vaccination, you got this pandemic that folks don't understand. And we're trying to navigate, do we trust the government? Do we trust the research? Do we trust the pharmaceutical companies? And especially amongst African Americans, only 15.2% in Minnesota even got the vaccination, was the lowest rate of any racial category. And a lot of it had to do with how we've interacted with the colonial structure.
Do you guys remember any of the, hesitation of people getting vaccinations?
Yeah, it was a lot at my school, especially on the basketball team, because they said either get the vaccination or you have to take a COVID test every Monday. And, the COVID test, you gotta stick it up your nose. It's really uncomfortable. And me, I had got COVID once, and it was like, I was out of school for like 2 or 3 weeks, and it was like terrible. But that like made me want to get the vaccination a little bit, but I still like was uncomfortable with it because I didn't understand what COVID really was, and I didn't understand the vaccine, and I didn't want to just put something random in my body. So a lot of kids did end up getting the vaccine because of like sports, because they had to be very precautious because you were all like together and it's easier to get sick. So there were a lot more like, oh, I might get the vaccine, or oh, I'm getting the vaccine.
I remember listening to the reports, whether it was the governor or health experts, and it was so intense. They'd have a lot of big words that I even was Googling. I'm just wondering, from the young people's perspective, how were you able to stay engaged day to day or week to week with the different changes that were happening when they weren't really bringing it down to just our regular language?
Facebook. Facebook is a Black community, so it's like we were talking about it. Yeah. So I just learned a lot from Facebook about other people's opinions and everything.
Yeah. Google helps every time. Like if they're talking about something and you don't really know what's going on, just head straight to Google. Yeah.
A lot of my family was like watching the news and stuff, so they would tell me about it because I wasn't seeing it on my own.
Yeah, the news also for me, but I would watch it with my family and try to be informed in that way. And also Google works too.
I was just about to say, were you sitting there Googling like me too?
Yeah, like if I didn't understand a term they said, especially medical terms, I'd be like, well, what's that? And then I'd look it up on my phone.
Beautiful. So technology pays off finally, huh?
Yes.
So Ruben, what is your advice to young people about being informed and staying informed? Where can they find information?
Yeah, that's a really good question. I think the first resource is your primary care physician. So it's okay to call your doctor's office, your nurse line, your school nurse, right? Your Health Start clinic. Your schools may have a clinic inside. Make that your first resource. Next, there are a bunch of trusted websites, the CDC, Minnesota Department of Health. Trust those websites. I know the popularity of social media, TikTok and Facebook and Instagram are good resources. If the resource is from from a primary resource that you can trust, go ahead and trust it. But be careful what you hear on social media. There's a lot of fake news out there, and I think it's important to reach out to your doctor, your medical professionals, or those trusted websites.
I feel young people lean towards social media more because it's easily accessible and it's kind of more understandable in a way. Like, for example, if Relly was talking about COVID, he'll use like language that young people would understand rather than the CDC using a lot of big words and a lot of medical terms that we don't really get.
Yeah. Is there anything else you guys would like to ask our expert while we have him here?
I would.
Go ahead.
What are some things that you did at home to keep yourself occupied during this hard time?
I worked out a lot, and so I got back fit. I worked on my beard, so I had just started growing my beard in COVID. I know I'm an old person, but I took a long time to get this beard as a reward, so I learned how to kind of care for my beard. I read a lot, right? Some of the things that I forgot, that was like cool, like reading and just having time to yourself. I spent a lot of time introspective, reflecting, reading, writing. And then I did, like everyone else, I attached to my phone, right? But what I did on my phone, I connected with friends from all over the world I haven't seen in years, old high school friends, old basketball buddies, and I found a way to kind of rebuild my community at home.
I know we've talked about the physical health of like patients and you yourself, but how was it mentally for not just you, but also your patients as well?
What was shocking about COVID-19, and remember we had a bunch of shocks that happened to the healthcare system, was that we saw this huge spike in mental health concerns amongst everyone in the world. Increase in depression, increase in anxiety, increase in other forms of mental health concerns. We can credit it to isolation, we can credit it to the fear people had around COVID, but I just think the society became more aware of how vulnerable we all are to mental health factors. And I think that healthcare now is much more responsive to that. We realize that we don't have enough mental health resources in our society and the right mental health resources for every community designed in our society, even for youth, to really respond to those needs. And so now we're gonna have to collaborate, listen differently, and put mental health as the health package as a priority across all populations in our communities.
Ruben, I want to thank you for your time and your expertise today and joining us at the Mask.
Yes, thank you
Thank you
so much. I really appreciate it.
So we'll be right back. We're going to have to take a commercial break, y'all.
We wear the mask that grins and lies. It hides our cheeks and shades our eyes. This debt we pay to human guile, with torn and bleeding hearts we smile. We wear the mask. Now we fighting racism and a virus. With our people dying at higher rates, it's systemic, the entire system is sick. We wear the mask to survive, not to hide our face. We wash our hands often, cover our face when sneezing and coughing. 6 feet apart is better than 6 feet deep in a coffin. We do all we can to safeguard ourselves and our kin. Hardships are harder when you're wearing dark skin, that's why we wear the mask. To protect the breath in our chest, we wear the mask. When we in these streets to protest, we wear the mask. And we can still keep it funky fresh as the power of our deep abiding love is expressed when we wear the mask.
We wear the mask to keep our families and communities safe. For more information, visit mn.gov/COVID-19.
Welcome back to The Mask. We just had a great conversation with Ruben Moore, talking about how COVID-19's been impacting our communities. But let's see these guys take it to the streets.
So, hi guys, I'm Mackenzie from The Mask, and I'm here with
Marquita.
Okay, and I just wanted to ask you a couple questions for our show. The first question is, do you have a trusted doctor's office or clinic that you trusted enough to give you the right information for the pandemic and COVID first happened?
Yes.
So, did you get a vaccine?
No.
Okay.
I'm definitely back.
How was your experience during the pandemic, and what did you think at first?
I would say it was kind of unbelievable. Like, can't be. But it's this big world we at, so you never know.
Right. What do you think would make the doctor's office and the government more trustworthy to us as communities?
I would say, for once, they need to have all ears open. Listen to everyone's opinion or how they feel about something. Because for once, you will not know what's going on with that person unless you take the time out and see what they're going through, and from there, and just talk to them. It's all about, it's really, if I'm a black person putting trust in someone else's hand in their life, most people have to have all ears. All ears. All ears.
Well, that was a great conversation out there. We had a wonderful conversation with our youth, with our community expert, and I think we're going to wrap it up. I'm Chantel, your host, and this is my crew. Thanks for joining us on The Mask. I hope to see you here at the same place, same time next week. Up next, we have our very own La Brea French to close us out.
Come jam with me as we're dancing under the school light. Trying to have a good time. Jam with me as we don't know what to do with our lives. Oh yeah, contemplating. Come on, boy, dance with me. You know you wanna dance with me. Come on, go rock with me. I see you moving towards me. Let's all just have a good time. Let's say go out there and have some fun. Don't mind the crazy people out there when they're shooting their guns. They say we have power to make a change. Then why do I feel hopeless every single day? I swear, tired of caring. Everything's overwhelming my brain. Just wanna listen to the music and wash my worries away. Come jam with me as we're dancing under this cool light. Trying to have a good time. Jam with me as we don't know what to do with our lives. Oh yeah, contemplating. Come on, boy, dance with me. You know you wanna dance with me. Come on, go rock with me. I see you moving towards me. Let's all just have a good time.